Whenever any of our family members or our peers who are undergoing chemotherapy, the question which comes to the patient as well as the relatives' mind is what is the food that they can take? What are the do's and don'ts? So today we'll try to discuss about what do you mean by neutropenic diet. So whenever a patient is on a chemotherapy which is known to bring the WBC count down to thousands or 500s or even below that, you are expected to follow a few specific rules so that you don't get infection. So the basic motto behind neutropenic diet is you don't give them food which can carry an infection risk or the pesticide risk which will increase or allow the cancer to grow. So we allow them to have boiled and cool water. The way we use pasteurization technique for boiling the milk and not eating it raw. Similarly, you have to use the same thing, be it Bisleri water or be it Aquaguard water. You still boil and cool them and then give it to them. And they have to maintain an adequate hydration of at least 2 to 3 liters per day unless they have renal issues. Now, coming to the food part of it, they shouldn't have anything raw or shouldn't have fruits which have pesticides sprayed on it like grapes or apples, which we don't eat without the skin. So they would be allowed to eat oranges or bananas where they can peel off the skin. They don't eat it with the skin and only the fruit can be ingested, which can be taken 2 or 3 times a day. But whenever a fruit is opened, it has to be ingested within 30 minutes of it opening and not allow it to remain stale. Now, they can take fruits or fruit juices of such kinds maybe once or twice a day along with nuts or dry fruits or dried crackers, and would be able to have these at multiple times in between. Now the lunch and the dinner, they usually have aversion or a lot of nausea to the food whenever the food plate comes to them. So that is a common scenario which is because of the post-chemotherapy nausea or delayed nausea. So usually they would be on antiemetics, but still this nausea cannot be curbed off. So they have to be on food which can be easily digested. They can have rotis, chapatis or bhakaris, but it has to be served hot. You have to prepare it within 30 minutes of while we are preparing for the lunch. They can have any of the sabzis which they like, or you can have along with the dietitians with whatever they can have it. They need to have a lot of green leafy vegetables. Anything of the sabzis has to be less on chilies, less on spices, because they tend to having a lot of nausea and can have gastritis because of that. And thirdly, it has to be cooked well, or it has to be at least steamed well. So even if they are having green leafy vegetables, it shouldn't be raw. It should be taken at least with a stew. And whatever sabzis that we are making, let them have a bit of water so that they can ingest and it will be easy for them to take it down. They need to have small frequent meals. So we may not be able to have normal lunch and dinner in them. They have to have foods at every 2-3 hours levels so that they can get enough nourishment all throughout the day. Thank you.